Alrighty, so I checked my patient, checked their MAR. Looks like they need an IV inserted and discontinued today. So I have all my supplies, which is right over here. I'd bring that in the patient's room with me. Knock. Hi, my name is Maddie. I'm going to be your nurse today. I'll wash my hands. And then the door is shut for privacy. Before we start, can I get your full name and date of birth? Awesome, that matches with the wristband. And then, are you allergic to any medications, dyes, food, anything like that? Penicillin, all right, I see that on your wristband as well. The patient's room is safe, the bed is locked and lowered. So today I'm just gonna be inserting and discontinuing an IV. If you have any questions along the way, please let me know and I will be talking out loud and kind of walking you through it as we go, okay? So put the patient's bed at a working height, get myself comfortable. So to begin, I am just going to be flushing some tubing that's going to be with your IV. I'm just going to be flushing that with some normal saline, so I won't be inserting the needle or anything right now, but please let me know, or I will let you know when I get to that point. So I'm applying my gloves, applying my gloves. Awesome. Now I'm going to take, we have our saline solution, then we have our sterile tubing right here, and the alcohol pad. So I'm just going to take an alcohol pad. Gotta get it out of there. All right, take the alcohol pad. And for this tubing, both ends are sterile, so I need to make sure of that. So I'm going to scrub the hub right here with the alcohol wipe. Throw that away. Then I'm going to take my my saline solution and I'm going to hook that up. And now I'm going to flush this tubing. Again, both ends are sterile, so making sure not to touch anything with either end. And then my tubing is open, so that's good. I'm gonna do this over the garbage can, just because it does go everywhere. Oh, just like that, squirted on the wall. But there is saline in there, it flushed right, and there are no air bubbles. So I'm gonna place this sterile tubing back in the sterile packaging for now. And then I'm going to take off my gloves. I'm going to re-sanitize my hands. Now I'm going to apply the tourniquet. So I'm going to have you lay your arm out just like this for me. Awesome. And now I'm going to have you lift up your arm. Great. So you can get the tourniquet ready. So with the tourniquet, I'm going to apply it about 4 to 6 inches above where I'm going to place the IV. Then I am going to use the open knot technique, just like this. And while that's getting set up, I'm going to wash my hands again and get my IV ready. So I'm going to apply my gloves. Okay, now looking at the IV, and this tourniquet can only be on for 2 minutes, so I have a 2-minute window. Looking at the arm, I think this vein right here will be best. So I'm going to get my needle ready, and I'm going to first swab the skin. So I'm going to swab in a side-to-side motion over the vein. So like this. And then I'm going to let that air dry. I'm going to get my needle ready. Alrighty. So take this off. And I am going to be inserting this at a 10 to 30 degree angle with the bevel facing up. So I'm just going to turn your arm a little bit. Good. And now I'm going to push down below where I'm going to insert it. So I'm going to insert it. Like this. and it looks like I'm having flashbacks of blood, which is really good. Now I'm going to insert it just a little bit more. So I'm going to apply pressure up here for bleeding. And as you can see, there is some return, so that's good. Now I'm going to take my needle out. And this is a sharp, so it needs to go in the sharps container when I'm done. So now that I have pressure above here, now I can attach my saline. So again, this tip is sterile, so making sure not to touch anything. So now I'm just going to connect to this, making sure to apply pressure still. Then I'm going to make sure that this is nice and tight. I can take the tourniquet off. Awesome. Now, I'm just going to apply pressure up here, and I'm going to push some saline through. Are you doing okay? Yes, alrighty. Good. There, we got some saline going through it, which is good. Now I'm going to take this saline off, put this over here. So now it is time to put the dressing change on. So we can put this, take this, and then I'm going to take my dressing. And with my dressing, I want to be careful not to put it anywhere but over the hub. So just gotta make sure which way this goes. There we go. So I'm going to place this over the hub just like this. I'm going to take this off, and I am going to put my initials, the date, and the time that I inserted this IV on here. Wonderful. Okay, that's all in place and everything looks good so far. And are you doing okay? Awesome, I promise we're almost done with this part. Okay, so now I am going to take some tape, and normally after this saline was taken off, then that's when this would be connected to the IV pole and the IV pump. So I'm just gonna take some tape. I'm gonna turn your arm a little bit. Awesome. And I'm just going to tape this part down just so that this stays in place. Alrighty, everything still looks good with the IV, and are you doing okay? Awesome. We can take the tourniquet, say clear up some of my supplies. Alrighty, I'm going to remove my gloves, wash my hands, and then I'm going to lower the patient's bed again, make sure that everything in the IV is working. I'm going to let your IV pump run for a little bit, and I'll be back in. Let me know if you have any questions. Your call light is right there. And then go out. Then once the IV is ready to be taken out, I'm going to knock again. I am going to wash my hands. Hi again, looks like your IV is done, so that's great. And are you doing okay still? Yes, awesome. Okay, so I'm going to put the patient's bed to a working height and get myself comfortable, and I'm also going to make sure that the IV is clamped so there's no fluid still coming out of the bag. Okay, I have my supplies over here. I'm just gonna wash my hands one more time. The IV state, when I'm looking at it, looks good. I don't see any bruising, redness, discharge, or any inflammation on the vein, which are all good signs. So I need some gloves. So we ran out of our clean gloves in here, so we're using this one. Alrighty, so we're just going to be taking your IV out. The most painful part is just going to be me taking the tape and the adhesive off, okay? So I'm going to disconnect the tubing from this. This clamp is open. Now I'm just going to take the tape off from here. You can discard of that. And now I'm just going to be taking the tape off of the catheter itself, so just let me know if it's too much pain, but it might hurt a little bit. So I'm going to keep this steady. I'm going to pull away from the vein with the adhesive. And are you still doing okay? Awesome. Okay. Good. So we can throw that away. Good. Now, holding this in place, I'm going to apply pressure with a gauze right above the catheter. And now to pull the catheter out, I'm going to pull straight out. Good. I'm going to cover this for 3 to 5 minutes and longer if the patient is on any anticoagulants or has any bleeding complications. Looking at the catheter, it looks like it is in place, so that is good, and that's good to note. Since this is a catheter, this can just be thrown in the garbage. Alrighty, so once the pressure is applied for 3 to 5 minutes, I can take this off and I can discard of that. And then it looks like everything, I don't see any more bleeding, any redness or anything like that. So I'm just going to take a new gauze over the IV site and I'm just going to apply an adhesive just in case there is a little bit of drainage or bleeding. There we go. Alrighty, so your IV is all the way out of your arm. Everything looks great so far. Please let me know if you have any bleeding. A couple drops, that's okay, but if you have any extensive bleeding, please let me know right away. I can take my gloves off, wash my hands, and then a lot of garbage in here. So I would gather all my supplies, making sure that everything is thrown in the garbage. The patient's bed is locked and lowered. Your call light is in reach. Please let me know if you have any questions. And again, if there is any excessive bleeding coming out of where the IV was, please let me know. All right, then I can leave the patient's room and I will document my IV findings and everything that I did with the IV today.